Deaths from opioids have quadrupled since 1999, ending the lives of over 42,000 in the year of 2016. This epidemic is now the overdose crisis in American history. Americans everywhere are addicted to all forms of opioids, both prescription and street forms. In Arizona, for example, opioid overdoses have risen 76% in the last 4 years. In Colorado alone, opioid overdoses have resulted in 300 deaths per year. Washington, D.C. has seen overdose deaths more than double from 2014 to 2016. This opioid epidemic has spared not a single state in our country. The entire U.S. has been affected. Several states have declared opioid abuse a public health emergency and had to dip into emergency funds to address the problem. Some counties have tried to enact the three-strike law due to the exorbitant amount of money that is spent on reviving people with Naloxone. There are several things that contributed to the opioid epidemic, so let's talk about some of them. In the late 1990s, doctors and healthcare professionals were faced with the pressure to find better ways to treat chronic pain. Around the same time, pharmaceutical companies began to market prescription painkillers. OxyContin, for example, was heavily marketed as a wonder drug that was able to take away pain and keep it away. OxyContin's manufacturing company, Purdue, marketed the drug to doctors and created music albums and other merchandise to persuade doctors to prescribe and patients to request. And at one point, doctors even thought that the risk for addiction was low. Over the next 2 decades, doctors started to prescribe large amounts of OxyContin or oxycodone to treat pain, and this increased the number of people who developed an addiction. Now there have been lawsuits filed against Purdue Pharma for the role they played in marketing an extremely addictive drug as non-addictive. Despite the rise in the opioid epidemic, it seems that opioids continue to be prescribed in large numbers. The opioid epidemic is still growing in our country, and every day people are dying because of it. When doctors stop prescribing for a patient that they have noticed is misusing or abusing their medication, they will often cut them off immediately. As a result, when faced with no longer having access to their prescription, they may resort to purchasing the medication on the street, or even worse, they may eventually resort to purchasing illegal heroin. Over the last 5 years, our country has tried very hard to take action against this epidemic. The opioid epidemic is now such a complex issue that there is no clear definitive answer. Each state has tried to enact laws and change prescribing policies for physicians to deal with the epidemic in their own way. This epidemic has touched the lives of millions of Americans without discrimination. Literally anyone can be affected regardless of race, color, or creed. If you would like to find a treatment center to help you with your problem, you can give us a call and we can help you. Trying to navigate the thousands of treatment centers can be a time-consuming and daunting task. Our addiction specialists can help you find the one that suits your needs and do it quickly. If you would like to learn more, please give us a call today.